I want to speak to you about the epidemiologist Boris Johnson. I'm not sure if he's out of Imperial or King's College. Can't remember. But basically, he said yesterday, we will trust the judgment of the British people. Your comments, please, on what is clearly a political expediency in the United Kingdom to move on from Omicron.
Well, they are happily seeing one of the countries that's seeing a decline in new infections, but not down to a baseline that would suggest it's time to lift all restrictions. So I think that is a political calculus. I don't have to tell all of you that he is in political trouble because of having violated and his staff having violated the earlier restrictions. This is unfortunately is one of those very clear examples where, a politician is making choices that are going to be popular. Nobody likes these restrictions, but that might undermine the public health response. I think that is just reckless.
Okay, that's important. That's the word I was looking for. I knew you were going to go there with great respect for your international work. It is reckless. Do we risk reckless in the United States of America?
Well, we already are at risk because, again, as I've said to you before, Tom, we do not have high enough rates of immunization in this country. We're still not at 2/3 of vaccination coverage. And I think the split decision by the Supreme Court, where we had support for vaccination for people who are in contact with Medicare and Medicaid recipients, that's a win, but it's a relatively small number of people who already were highly vaccinated. The loss on the jobs mandate and the workplace safety for employers over 100 employees is a real loss because it's going to prolong the pain. And so that's still our biggest vulnerability. The data are showing, again, where you have high rates of vaccination and high rates of boosting. Boosting really matters with Omicron. You do see much less hospitalization and much less loss of life.
Dr. Beyrer, just to sort of put a bow on the comment that you just made, do you think that it is reckless to call the end of the pandemic phase and the start of the endemic phase of COVID in the next couple of weeks? I mean, do you think that that would be a reckless moment based on the vaccination rates?
I do, mainly because, when you look at the numbers of new infections, it's over 700,000 a day, 2,000 deaths a day. The healthcare system is stretched. It remains extraordinarily stretched. And I think one really telling figure, we just learned this week that 1 in 5 people who work in the healthcare sector in the United States have left that sector in these 2 years. That's extraordinary. That means that we are really stretched. And so it is absolutely reckless to say, okay, we're going to get through this wave and then we'll be done. We don't know that. We didn't predict Omicron. We didn't predict Delta. And this virus has shown an extraordinary ability to mutate around our best efforts.
So let's talk about the immunization that you get from getting Omicron, because a lot of people are saying, well, we're actually moving to something more of a baseline of immunity, regardless of vaccination, with all of the infection rates that we've seen with Omicron. How effective is that at preventing other strains? How much of a boost to a sort of collective immunity do you see that as?
Well, this is what Omicron has taught us. Omicron is a variant that is able to spread at the rate that it's spreading because previous infection and indeed previous immunization without boosting, it turns out you get a lot of breakthrough infections with this variant. That's why it's spreading so quickly. It's highly infectious, but it also evades immunity. So the likelihood is that that's what the next variants also are most likely to look like, because they're going to need to now be able to spread in an environment where so many more people have either been vaccinated or had Omicron or Delta. So we'll have to see. The jury is out on that. I do think that one of the things that is really encouraging is that South Africa is a good example. So is the UK. Places where there was a lot of Omicron do see these rapid declines. We're seeing that now in New York, New Jersey, Connecticut. Some of the earlier places that were hit with Omicron are showing about a third decline in new infections. So that is really going in the right direction. But, we're a big heterogeneous country. We have lots of areas with low vaccine coverage, and we're still, of course, seeing an enormous number of cases and way too many hospitalizations.
Doctor, given the current trajectory, I just wonder from a policy perspective whether we are getting closer towards a situation which is the ultimate objective when it comes down to personal responsibility, not collective action to protect the healthcare system. Do you think we're getting closer to that?
I would say it's a mixed bag. And there are too many places where people are not taking responsibility and where, as I said, vaccine coverage really remains a problem. I was just speaking yesterday with a public health official, a friend and colleague in Mississippi, talking about their very low vaccination rates and their ongoing surge. This is still our challenge. And unfortunately, as you all know, it's a politicized challenge, and it's a real divide in this country.